So I timed both over here and then I divided it, and it turned out to be 2 milliliters.
Does everyone agree with that? All right.
What does the S in the parentheses mean? On the worksheet?
Brown pen. I blew it's really hard for everyone to see the back. What was your question? I'm sorry.
What does the S in the parentheses mean?
In the question at the end.
It could be 1 ml or multiple ml.
Plural. Plural.
ML is the plural.
Get used to like reading this kind of stuff because you see this on the test. You better know, how to decipher it. Just the plural.
What was that like the? I mean, it's kind of obvious, but like
It's
the
whoever typed
capital,
it up.
capital L and like the lowercase L mean the same thing, right?
Oh, yeah.
So the typos.
Whoever typed it.
I did get it.
Mill in milliliters is ml. Right, same thing as the cc milliliters. Okay, be brave. Do the next one. Acetaminophen. What's acetaminophen?
Tylenol.
Right. What is that called? That acetaminophen. Is that a generic name?
Yeah, generic
And
name.
Tylenol is a trade name, right? Okay. So acetaminophen is available at 160 milligrams per 5 mils. What's acetaminophen here? Great. I'm not gonna bite you, I promise. You guys get involved in this. Alright, so you have acetaminophen available in 160 milligrams per 5 mils. The order is for 240 milligrams. How many milliliters would you get? 150 milligrams per 5 milliliters. That's what you got on hand. Yeah. Remember, desired dose over dose on hand. The trick is you guys probably know, but I'm going to tell you anyways, with math, if you know your formulas, you got it down pat. Just remember desired dose over dose on hand. Everyone agree with that? Alright, next one. The patient drank 12 ounces of orange juice. How many milliliters are in an ounce? 30. So that's why you know those little medicine cups for those of you who are in the hospital before they're kind of clear plastic. You'll see pictures of your book if you haven't seen a real one. It's an ounce. That was cup. That's a 30 cc ounce. 30 cc to 1 ounce, right? So the question is, the patient drank 12 ounces of orange juice. How many milliliters did the patient drink? 3 times 12. 30. 30 cc to an ounce. So they drank 12 to 1 ounce, right? Right. Everyone agree with that? How many ounces are in a cup? 8 ounces in a cup. So how many cc's are in a cup? 140. Right. Now you see that is? All right. The next question.
What was the answer?
Keep this stuff in your head.
How did you get that? 3, 4 times.
8 ounces.
Each ounce is 30.
3 8 is
So
24.
how many ounces times 30? 8. 8 times 30 is what? 240.
Is that what you said? 240 is what she said. 40 ounces? She said 240. She said 240, right?
Number 5?
Oh, okay.
She said 240? What thing is it?
No, she's talking.
Is she doing it right now?
How many milliliters did we drink? So, well,
I'm totally confused now.
I think she's writing it out.
For number 5? Yeah, 2 to 5.
Next one. The order states give 2.5 or 2.5 teaspoons of Motrin every 6 hours. How many milliliters should you give? So the first thing you need to know is how many milliliters in a teaspoon. 5? Everyone agree with that?
Yeah.
Okay. So, and you want to give 2.5 teaspoons of Motrin every 6 hours. So how many milliliters should you give to the patient? Hmm?
12.5.
Everyone agree with that? Patient weighs 70 kilos. How many pounds is that?
154.
So you're just taking the 70 and multiplying it by
2.2.
Patients receive Ativan 3 milligrams per injection 2 hours after surgery. The drug is supplied in a vial 4 milligrams per milliliter. So how many milliliters are you going to get?
0.75.
Everybody agree?
Yes.
All right. Patient drank fluid limit and patient reports she had. As you go through each semester, you're going to get more and more of these. They're going to get a little bit more complicated. I know this sounds really elementary, but the building blocks as you go on. Because some fourth semester, Francis always has some really good questions about INOs. And you're going to get stuck, a lot of them get stuck on it. So just kind of FYI, really pay attention to how you read the question. Because one of the things you're going to be learning is how to take tests in this program. So, okay, so patient has a fluid limit, and patient reports she had 6 ounces of orange juice, 8 ounces of water, and milk on her cereal and half a carton. So half of 8 ounces is 4 ounces, right? Yeah. So how many milliliters? 18. Right? 540. So 30 times 18 is that 540? 540. Right. Last but not least, patient baby weighs 4,500 grams. What is the weight in kilograms? 4.5. Right. And we know the kilo in Latin is 1,000, right?
Right.
If you can, it's supposed to be that all of it, any little bit of Latin, always have to break down words. I think that's exactly what it is. Does everyone feel comfortable with that?
What did you say was answer for men? Oh, I don't know. She lost me a while ago. Okay. I do a lot of self-studying and self-teaching, so I don't learn much in class.
Yeah. We need conversion.
Well, wait, you're going to come back, so, well, still a little bit of time here. There's a couple this is on your Thursday, so I'm not going to cover something. We talked about medication.
Do you want to take a look at the answers? The only one that I think I didn't.
Oh, yeah, thank you.
Or you can take pictures of it. Whatever's in purple is correct.
I just want to make sure I have it for, so when I go home.
You can just take pictures, it's easier.
Okay. My camera sucks.
Unit is always unit. We use unit, not unit. Not unit. Okay? So we always spell it out. For morphine sulfate, not MS, not MSE, it's just MS. That's the morphine sulfate. For numbers, this is a really important one because people made mistakes. So every time there's a change in practice, it always goes back to something happened. All right. So usually it's a sentinel event. What is a sentinel event? Does anyone know what that means? If you hear the term sentinel event, that means somebody did something in the patient's side. Really bad. Case in point, remember the twins who aborted feeders and really screwed up behavior? That's what you call a sentinel event. Although they lived, that's a sentinel event. Everybody knows about it. And then there's always going to be a change in practice when something like that happens, because we learn from our mistakes. That's how we go forward in life. So,
If I recall, sorry, I recall the definition was any limitation, compromise in functional status that aspect avoided. Was that the definition? Thanks.
something really bad would happen. That's more of a correct definition.
Thank you.
So, thank you for that. So with numbers, let's say I want to give 0.1 milligrams or something. That's kind of an absurd dose, but I'm making a point by showing this to you. You never have 0.1.
Yeah.
The reason for that is if you miss the point, you give them 1 when only 0.1 is ordered. So if you have a decimal point, always make sure you have a number, even if it's a 0, in front of the decimal point. Now, for numbers beyond this number here, right, the decimal point, if there's zeros, don't bother putting them down there because they're worthless, right? They don't mean anything. But you look at something down there, if you have like 1, 5, 7, or something like that, right? For rounding off, if it's 5 or greater, you round off to the next number. And this may vary from instructor to instructor. It's 5 or less is down, and above is greater, so you can always round off. So when you're taking tests, make sure you ask if they're going to be doing that, they're going to be rounding off, because most of the time they will round off. And again, from the day before here, so the time you graduate, you're being prepared for NCLEX exams. And that's the exams and so forth. Again, it's teaching you how to take the test. But most importantly, also, you're learning material content. So once you graduate and you start practicing, you're a safe practitioner. Any questions? Okay. There's a couple other things I wanted to talk about. There's 6 rights of medication administration. So I'm just going to dive into this because none of the other instructors are doing so. These are things you're going to need to know. Have you guys heard of what the 6 rights of safe patient medication is?
That is right with an R.
Right.
Yeah.
Right, patient. So when you go to the patient's room, IV band, the order, the medication, by time, by patient, by time, by dose, by route. Right? And what else is there? And then also documentation. Documentation is imperative. Because with anything you do, whether it's giving meds, giving a bath, whatever you're doing, if you didn't document it, you didn't do it. Because that's going to be your saving grace. So you gotta always document what you did.
Can you repeat that?
It says,
This is,
Okay, one device patient. Again,
this is the 6 rights of medication administration.
these are, I'm going to put them right in order, the 6 rights of medication administration. Like drug, dose, patient. This would be exactly how it's looked at. Drug, dose, patient. And what they've done now, most hospitals now have all gone electronic. So just depending on the facility that you're at, we have fixes. They're like a computer, and the medications are in different drawers. And then you have to scan it, that's how we charge for them. Also, that's a double check with pharmacy to make sure you did get the right drug and the right dose. So if you have, say for example, a pill that's 650 milligrams, and you only have 325 ordered, it'll have like a little red thing. This is like less than what is ordered, so what you pulled out of the drawer. So it reminds you of breaking in half. At any rate, route, time, and documentation. What do they mean by route?
By law. By ID.
And remember, you guys, no question is done. If you don't know something, always ask, you know. Nobody knows everything. If you think you know everything, then you're in trouble. No one knows everything. And that's the neat thing about nursing, is you're always learning. Things are always changing. Okay. Those are the 6 rights of medication. These are things that you burn it into your brain. These are things that you need to know. Route, let's take a stab at that. That's a good question. What do you mean by route?
How to take it, orally, IV.
PNG, IV, sub-Q,
Going into your body.
Exactly. Thinking going into your body. You never put anything into a person's body like a Foley or an NG without an order. Because that would be standard. So anything that's invasive in a person's body, and if they refuse it, then that's their right to refuse it. Just if they refuse it. Why did you put the NG in? If you refuse it, that's their right to refuse that. But just remember that. That's a really good legal thing to remember.
How does that work when you have patients that have like encephalopathy, or they have like a psychosocial, you know, they're not in their full state, right? What do we do when we have patients?
If they're not able to, if they're confused or they're, you know, whatever, then you've got to, in order to, why are they encephalopathic, for example? Let's say they're going to be diseased or whatever, ammonia levels up in liver failure or whatever. And the patient's confused, and they really are not in state of mind to really make an intelligent decision insofar as health care.
So even if they were to resist or
Well,
reject
I mean, you
it,
have to, like, every patient's different, every situation's different, and you have to use your common sense. If the patient's thrashing about, you're not going to try to put an end to your problem. The patient's, you know, out, they're agreeable to the energy tube. Every situation is different, and if you don't know, ask when you're calling for other nurses for their opinion. Because when you start working, it's a huge learning curve. But you're going to learn so much the first year when you start working. And always makes sense.
so it's a judgment call at the base.
It is, yeah, it is.
There's
yeah,
no right or wrong.
You don't want to do harm to your patient, you want to get them better, but at the same time, you don't want to put in jeopardy yourself.
So you're supposed to have, don't they supposed to have a legal guardian? They're not able to take the office?
Well, that's a good question. What is that called? Information has an advanced directive. What's an advanced directive? Does everybody know what he said?
No, we can't give you.
When you guys talk, please speak a little bit louder, because everybody else wants to hear what you have to say. An advanced directive is a legal document, and it basically is, say for example, I just got in a really bad car accident, and I'm no longer able to make decisions for myself. So I've appointed my sister to make decisions for me on my behalf. And I've had a conversation with her before saying, I don't want to have all these tubes in me, I don't want this, that, and the other done, but give me like a week to see if I can get that done for me, that kind of thing. You know, and it's, you have appointed someone to act on your behalf in your best interest and will honor your wishes. That's what an advanced directive is. So I have directed this person in advance to make decisions, medical decisions on my behalf if I am incapacitated and not able to make decisions for my health. Yeah. and everyone really should have one. And so every so often you'll see cases where advanced directives are in place, but then the person really doesn't want to let go of the patient and is really acting against that person. People want everything done, keep everything going, and the patient never wanted that to get in. Really have conflict. And then you end up having those ethics for the real. You want to make sure whoever you choose to be have an advanced directive for you is someone that you trust.
What can you do with the attorney, or you just have to write it down?
You need to get this notarized, and all the hospitals have it in your billing department. And it's a big thing. It's really important to do.
We did, some of us probably did the HIPAA, and there was one question in there, I don't recall if the gentleman being the patient was unconscious or not, but I believe the family member locked up and wanted to have information from us. So what if the patient is admitted unconscious and we don't have any information if there's an advance directive on file?
If the patient is in a coma and the immediate family, not friends or neighbors, if the immediate family wants to know what's going on, there's no advance directive in place, then yeah, you need to let the family know what's going on with the patient, and the patient's not able to speak for themselves, and that's their right to know what's going on with their loved one. HIPAA is, you read that HIPAA last night, is that part of your legal assignment? What's HIPAA?
I put it on the general.
What is HIPAA?
We were supposed to be doing it about it last night.
Did all of you read about HIPAA?
Yes.
I mean, we play it.
So it's a big thing, it really is nationwide. Basically, you're not supposed to be giving any information out about the patient to anyone other than like their immediate family members. And of course, if the patient doesn't want a certain immediate family member to know anything about it, the patient's right, so they're still able to make decisions for themselves. And this little segue to that is like when you guys are in the hospital, you're not to be talking about patients in the elevator or in the cafeteria, because the walls have ears and it's happened, and it's really bad. Number one, the hospital gets fined a huge amount of money for a HIPAA violation. And number two, you represent Los Angeles City College, so you're there for whatever facilities you're going to be going to throughout the duration of this program. You are a reflection of this college, so you want to put your best foot forward, always look professional, act professional, and don't be discussing patients in any public area. All right? And really be careful about that. And every so often you may see staff doing that, and that's just a big no-no when other people's mistakes, but don't do it yourself. Because I guarantee you, if any of you do it, we will hear about it. Okay, how'd it go? Really good. You got a smart group here, you guys. Yahoo! Yahoo! So did we go through all of them?
Yeah.
All right. So do you feel more comfortable with that kind of, processing? I mean, there's no way to get around it. You will have to memorize the metric conversions because that's just the way it is. If you have test anxiety, and I'm going to be able to figure out which ones you are because I can feel it when I'm in the room. I can hardly breathe with their stress from the testing anxiety. But what I have always, every test that we have here, you always are allowed a few things in the testing question, which is at the computer. You get randomized seed, you bring one piece of paper that's clear, nothing written on it, and you put your name on it, but that's it. And our computer lab's a little nicer than the library, nothing to drink with items, not nuts, but water with a cap top would be okay. And then you cannot have your cell phones on you, you have all of your possessions are put in the front of the room, all right? So that we know that everybody's just really calm and do some cleansing breaths before we start. But when you are stressed like that, a lot of people will go, okay, like all the metrics. Because you want to do that before you even start the test. That has been a wonderful technique for math anxiety and stuff like that. Because then you'll look at a problem and you're like, is it 30? You know. So put your calculations in your brain on the paper first. This also works very well for fluids and electrolytes because there's no way around it. Memorizing what's abnormal and normal. I mean, you just have to know it, you know. Do I know it like that? Kind of, but there's still some labs where I go, what is a digoxin level? I'll look it up. But anyway, I just wanted to share that with you because, you know, there is no room for math errors in a clinical setting. But it really isn't. And to this day, I do 3 calculations. I think in my head, and I'm like, oh, okay, and I do that picture thing, where I draw the syringe and I go, well, I'm just going to be using half of it. But I still, like, think in my mind, okay, so then I'm going to write it down and do a calculation just to make sure. And certain drugs, you have to get a 2 RN sign-off, okay? So then, but for calculations, I'll do it on pen and paper or pencil in my little pocket, and we'll talk about what you need to have in your pocket in clinical. But then I will have my calculator and just double check. That's a double check. And if I'm not feeling good and I'm feverish, I shouldn't be at work anyway. But anyway, if I'm feverish and I say, check me out, can you just make sure this is right? And that's it. I mean, we're, you know, 2 errors human, but not in this. It's just, it's too hard to fix it. All right, so are we ready? How many of you got ready this morning with a little bit of water? Whether you brushed your teeth, take a shower, I knew you weren't going to get it. I just made it a little sketchy. Anyway, we're going to talk about hygiene, bathing. We're going to watch. So you're going to have to jump up there. Of course, is are you sure?
Yeah.
Me? I can't. I'm a fall dresser. So, oh, and you even did the documentation. Oh, I have something to make you do that. I brought it special for you. All right. So if you are having any questions, concerns, or feeling like you're going to have hiccups are a little problem. Then you need to come to either Professor Walker or myself, okay? So I don't want you to have hiccups.
Oh yeah, then it's gonna get warm. Hey, over here. You don't have any like tests in here.
One that I know so far. But I'm pretty sure 104 is going to apply some knowledge.
But like when we get tested in here, it's like all physical stuff, right? Like, but not like regular. Yeah. Oh yeah. Checkup list is on right to print. So they're not on there yet. It's just
They're going to give us to they're going to ask us to print out information because
oh yeah, right. The first week. Hey, did you start the care plan for farms? Did you start the care plan for farms?
If I started,
No, for farm. Farm has a care plan. It's like it gives you a situation. Yeah.
no, that's what I was telling you. That I have to start this. I don't know if you can kick it off.
Yeah, you can. I'll look at it. When you first click into it, it'll say you can go back. If you can go back and forth, that means you can click out. So that's why I want to click in and be like, okay, what am I dealing with first before I even start it?
Hey, good morning.
You can go back and forth and don't open it.
Yeah. Somebody was sitting there this morning because I wanted to sit in the front.
This doing me. I'll give it twice.
Because I was thinking that maybe we should do that.
All together? Do we have this situation?
Save me a spot tomorrow in the front so I can record.
But because the case study thing on there was that you have to take your nursing diagnosis, you know, like the assessment, diagnosis planning, and you have to put that into like your plan of how you're gonna take care of the patients, like what you're gonna. So we can kind of like talk about it and then raise it together.
Just like, I don't know what you want us to do.
Just like a little
Kind of take much of
I know, but we already have it assigned. Just do it the best you can. I think we should just go over it and then talk about it and maybe get ideas on how to do it. Nurses?
No, like in the case.
I don't think so. I would think you would have to get the approval from the doctor.
So we just make the patient contract.
Yeah, and then give them to the doctor and then see what they want to prescribe. Because they're going to actually diagnose it. We're just there to like kind of get them comfortable. Diagnose, but to a certain extent. They're saying no, you can't say that.
Like that, but we can approach.
Yeah, like if you think that they have that, then you maybe would order certain things for them to get done.
They're having clinicals
Well, actually,
tomorrow,
not even know if you can do that. That's like the doctor's thing.
They're at 11.
See, that's the thing that's I want to be a doctor.
Just until 11:30, I think.
Yeah, that's why I think I want to do a nurse practitioner.
Everything that I said is.
Yeah. I know.
I caught people
You know, when you
Where did you get that sandwich?
It looks really good. What?
The sandwich?
Oh, I think I have another half in there. You can have it, I think.
Oh no, it's okay. No.
Oh, I got it from the cafe on Vermont at the light.
Oh, that little place?
Yeah.
Oh, okay. So
Open
it's
up 6 a.m.
Nice.
Yeah. Okay, never mind. I bet I'll cook it.
Really?
Okay.
He's actually
Right.
very down.
Okay.
Easy to talk to.
What did she say? Oh no, at the beginning. Oh, that's what you're saying. You have to try
Thing. Oh, really? Oh, okay, yeah. Pasadena first was like, are you on the wait list? And then the week of, they called me and was like literally the week of, they're like, oh, we have a spot, you know, do you want to take it? I'm like, no, because I'm already in. But I did want it because it was too far. I did want to go there anyways, but I had to apply because they said to apply to like, right? Yeah. So I was like, oh no, I'm sorry, you got infected. They're like, okay, you know, they were just like really rude about it. But a lot of them, whenever I said no, they were like, oh, you know, I asked you why. You know, of course you know where you're going, and they're just like, okay. You get that vibe. But I'm like, sure, you probably know a lot of people go to your school. I didn't get into Penn State because I think my seats close to like 60 something, pretty low. But it's cool, I didn't want to go far anyways. The only thing is, like, now I have to try to get to the lab.
Wake up! Step out!
Oh, we're back today.
Do not go to sleep.
First, assess the patient's skin and other factors. Then give him a chance to void. After arranging all the supplies on the overbed table, raise the bed to a comfortable working height, lower the side rail near you, and help the patient into a supine position close to that side of the bed. Then place a bath blanket over him and ask him to hold the top of it as you remove the top covers. Now remove the patient's gown or pajamas. If he has an IV line, an injury, or reduced mobility in one arm, begin removal from the unaffected side first. Then take off the gown from the other side. Remove the IV tubing from the pump, take a container off the pole, and slide the container and tubing through the arm of the gown. Then rehang the container and adjust the flow rate as needed. Raise the side rail and then fill the wash basin 2/3 full with warm water, being sure to check its temperature. Also have the patient test the water temperature to make sure he can tolerate it. If desired, warm the body lotion in the water. Now lower the side rail and, if allowed, remove the patient's pillow and raise the head of the bed. Place one towel under his head and another over his chest. Then immerse a washcloth in water, wring it out thoroughly, and form it into a mitt as shown. If the patient is not wearing contact lenses, wash his eyes with plain water, bathing from the inner to outer canthus, and using a new section of the cloth for each eye. If needed, soak any eyelid crusts for 2 to 3 minutes before removing them. Dry around the eyes gently and thoroughly. Next, wash, rinse, and dry the patient's forehead, cheeks, nose, neck, and ears without soap. Or if he prefers, use soap to wash these areas. Ask a male patient if he wants to be shaved.
Would you like to be shaved today?
No.
For an unconscious patient, use a washcloth to clean the eyelids from the inner to outer canthus with plain warm water. If prescribed, instill eye drops or ointment. And if the patient has no blink reflex, keep the eyes closed and covered with an eye patch or shield. Now remove the bath blanket from the patient's right arm and place a towel under it and the basin under his hand. If you're going to provide nail care, let his hand soak for 3 to 5 minutes and clean under his fingernails as needed. While the patient's hand soaks, wash and rinse his arm from the fingers to the axilla, using long, firm strokes and minimal soap and water. Then wash and rinse his hand and dry his entire arm and hand.
And rinse your eye.
With the patient's arm raised and gently supported over his head, wash, rinse, and dry his axilla thoroughly.
Do you like deodorant or powder?
Deodorant.
If needed, apply deodorant or powder to his underarm. Then at the other side of the bed, lower the side rail, place the towel under the patient's other arm, and clean that arm, hand, and axilla the same way. After cleaning both arms, cover the patient's chest with the bath towel and fold the bath blanket down to his umbilicus. Then bathe his chest under the towel using long, firm strokes. For a female patient, take special care with the skin under the breasts, lifting them up with your hand. Remember to rinse and dry the area well. At this point, check the water temperature and change it if needed. Otherwise, continue by moving the bath towel to cover the patient's chest and abdomen and folding the bath blanket down to just above the pubic region. Then bathe the abdomen under the towel, paying close attention to the umbilicus and skin folds. To wash the lower extremities, cover the patient's chest and abdomen with the top of the bath blanket. Then expose one leg by folding the blanket toward the midline, but keeping the perineum covered. Next, place a towel under his leg, supporting it at the knee and ankle. Now wash the patient's leg using long, firm strokes from the ankle to the knee, and then from the knee to the thigh.
Go ahead, finish rinsing up.
After rinsing the leg, dry it well. To continue, wash the foot and clean carefully between the toes. Clean under the toenails if needed. Dry the toes and feet completely, and then discard the towel in the linen bag or hamper. Now move to the opposite side of the bed, lower the side rail, and wash the other leg in the same manner. If the skin is dry, apply moisturizing lotion. After raising the side rail, change the bath water.
Get some fresh water, I'll be right back.
With fresh bath water at hand, lower the side rail and help the patient into a prone or side-lying position.
I would like you to help me turn you onto your right side there. Keep warm. Okay, your arms okay?
Mm-hmm.
Place a towel lengthwise along his side or back. And keep the patient covered by sliding the bath blanket over his shoulders or thighs to expose only the area to be bathed. Working from the neck to the buttocks, wash, rinse, and dry his back using long, firm strokes.
How does that feel?
Then bathe the buttocks and rinse and dry the area.
And reach now off the done in 2 minutes.
Apply body lotion or moisturizer as needed. When you're finished, cover the patient with the bath blanket. If the patient is able, allow him to clean the perineum himself. If not, perform perineal care for him. For details, see Performing Perineal Care for a male patient or Performing Perineal Care for a female patient. For some patients, a commercial bag bath or cleansing pack may provide a quick cleanup. First, warm the cleansing pack in a microwave, according to the package directions. Use a new, individual pre-moistened towel for each area of the body to be cleaned. Allow the patient to wash herself as much as possible to promote independence. Assist as needed. When bathing is completed, apply a clean gown or pajama top, dressing the affected side first. As needed, assist the patient with grooming, oral hygiene, and hair care, and then make his bed. For details, see the appropriate video skills. As part of follow-up care, have the patient rate his level of comfort and ask if he feels fatigued.
Thank you very much. That's very nice. Thank you.
How about anything for pain?
No,
Okay. Would you like a drink before I go?
no.
All right, I'll just pour some and hand it there for you, okay?
Before performing perineal care for a female patient, determine how much of it she wants or is able to do herself. If she has no restrictions on positioning, help her into the dorsal recumbent position, with her knees flexed and her legs wide apart. With a waterproof pad under the patient's buttocks, drape her with a bath blanket so that it forms a diamond shape. Expose the patient's perineum by lifting the lower corner of the bath blanket and folding it up between her legs and onto her abdomen. After checking that the water temperature is comfortably warm, form the washcloth into a mitt, apply soap, then wet the washcloth and squeeze out the excess water. Wash the patient's upper thigh to remove perineal secretions from surrounding skin surfaces. Repeat washing and drying for the other thigh. Then rinse and dry this area. Using your non-dominant hand, gently retract the labia majora from one thigh. Using your dominant hand, carefully wash in the skin folds from the perineum to the rectum. With a separate section of the washcloth, clean the labia on the opposite side. Next, gently separate the labia with your non-dominant hand to expose the urethral meatus and vaginal orifice. With your dominant hand, wash down from the pubic area toward the rectum in one smooth stroke. Use a separate section of the cloth for each stroke and clean thoroughly around the labia minora, clitoris, and vaginal orifice. As you do, check for pain, redness, swelling, discharge, irritation, or skin breakdown. Now rinse the area thoroughly. For a patient who can use a bedpan, Do this by pouring warm water over her perineal area. If the patient cannot tolerate a bedpan, thorough rinsing with the washcloth to remove soap residue is critical. If the patient has an indwelling catheter, clean around it carefully to avoid putting tension on it. Then dry this area thoroughly, again working from front to back. Finally, fold the lower corner of the bath blanket down over the patient's perineum, ask her to lower her legs, remove the waterproof pad, and help her into a comfortable position. As part of your follow-up care, assess the patient's comfort level and degree of fatigue.
Are you feeling okay? Are you comfortable? Yeah, it's okay for you? All right. Get you both down. Is your head up high enough? This is your call light. Can you press the call light there? All right. Can you reach your Kleenex? Do you want them in the bed with you? Okay.
To perform perineal care for a male patient, first determine how much of it he wants or is able to do himself. If there are no restrictions on his mobility, help him into the supine position. With a bath blanket over the patient's body, fold its lower half up to expose his upper thighs. When filling the basin, wet the washcloth, check that the water temperature is comfortably warm, squeeze out the excess water, form it into a mitt, and apply soap to it. Then wash, rinse, and dry the patient's upper thighs. Next, cover his thighs with a bath towel and raise the bath blanket to expose his genitalia. After lifting the penis and placing the bath towel under it, prepare the washcloth and apply soap. Gently grasp the shaft. If the patient is uncircumcised, retract the foreskin before washing. Starting at the urethral meatus, wash the tip of the penis with a circular motion from the meatus outward. Repeat this action with a fresh area of the washcloth until the penis is clean. Then rinse and dry the tip of the penis gently. For an uncircumcised patient, be sure to return the foreskin to its natural position. Adjust the bath towel to allow cleaning of the shaft of the penis and the scrotum. Now, have the patient abduct his legs. When cleaning, pay special attention to the underside of the penis where secretions can accumulate. Then lift the scrotum and wash it carefully, including the underlying skin folds. Now rinse and dry these areas thoroughly. As you do, check for redness, swelling, discharge, irritation, and skin breakdown. Finally, remove the towels and bath blanket and pull the patient's gown down and the covers up. Then help him into a comfortable position. As part of your follow-up care, Assess the patient's comfort level and degree of fatigue.
How does that feel?
Better.
Good. Can I get you anything?
Pretty good, thanks.
All right.
Ready to start practicing?
Yes.
Ready to start practicing? We're going to use a mannequin on a bed. I need for you guys to actually use your basin, fill it up with actual water and actual soap. We're going to be mimicking that method on a mannequin with actual water. Okay, so the ones that have mannequins already have basins, towel. We're using the sheet as your bath blanket. Okay, you have your towel, and then this makeshift washcloth is your washcloth. Okay, so I'm going to assign you into groups 5, and then we'll go ahead and disperse it. So what I need for you guys to do is that 2 people will wash at the same time. So one will wash one side, one will wash the other side. Okay, and then we'll spend time doing that, and then we'll move on to the bed. Is there any questions on the method? Pretty clear cut?
Like as far as like the head and like, you know, compressing facilities, do you ever wash or the hair?
That's only based, it's not done daily.
Oh, okay.
That's only based on preference or once a week. If that's done, meaning like hair washing and that, yeah, that would be something that would be done daily. This is done daily. Any other questions?
I have a question. This is really, really kind of uncomfortable for me to ask, but when they were washing the backside, I didn't notice them actually pull up the butt cheek and wipe
And
in.
you should, yeah. So it depends on the independence of your patients. Sometimes they will leave that for pericare. They'll wait for pericare to do that since you're already going to be in the perineal area. They'll wait to move that over to the pericare section and then just do that all at the same time.
Are we going to be using the same washcloth throughout the whole procedure, or we can switch out?
I mean, it depends on the soilability of your cloth. So if you have someone that's fairly clean, because you're doing this daily, right? Your patient should be fairly clean. If there's someone that has some type of drainage, then you would switch it off, but you would already have that supplies ready for you.